Our next panel will be chaired by a scientist who does a lot of work with getting information out through the media, Dr. Tom Inglesby of Johns Hopkins, directs our Center for Health Security. And this will be a discussion with leading journalists covering the vaccine trials and the COVID pandemic more broadly. Tom will be joined by Apoorva Mandavilli from the New York Times, Sarah Zhang, a science reporter for The Atlantic, and Will Stone, who covers COVID for National Public Radio, NPR. Each of these journalists has written extensively on the COVID vaccine trials, and we've asked them to engage in a really important discussion around integrity in communications and reporting of science. So Tom, the floor is yours.
Great, thanks so much, Chris. It's great to be part of this really critical discussion today. Let me just start by saying that I think it's pretty obvious at this point that the press has played a truly critical role in helping the world understand and navigate this pandemic. And I think in the US in particular, the press has helped the public understand the science of COVID in a really strong and clear way. It's helped to separate fact from fiction. And there's been a lot of fact and sadly a lot of fiction. And the press has uncovered many things that I think would have been really hidden or obscured. When I interact with the press covering science, I think the goal for me is to present what the science shows, what public health shows, and it's not our job in science to reassure. I think it's our job to say what is factual, and whether it's good news or bad news, the public can handle the facts, and the public needs the facts to make good decisions for themselves and their communities. I think this is going to be especially important with the COVID vaccine. And a strong free press is essential to identifying and communicating about the COVID vaccine and to monitoring the integrity of the process as it unfolds. And certainly the Times, The Atlantic, and NPR have been crucial press outlets in keeping the public informed and engaged. And so with that, I want to thank Apoorva, Sarah, and Will for being on this panel. And I want to start with a question to the group. At a high level, what's the role of journalism in protecting the integrity of science around COVID vaccine development and science more broadly around COVID? And does the media have a different role during COVID than it usually does around reporting on scientific developments? And I'll just open it up to any of you. Would love to hear all of your thoughts on that. Anyone want to start? Apoorva, I think you're on mute.
Okay, sorry about that. I can jump in and say that one thing that you said really struck me is, it's not our job to reassure. And I think that's even more true of science journalists than it is, and journalists in general, than it is of scientists. I think, we're not there to reassure the public, and we're also not there to be cheerleaders for science, which I think scientists sometimes think we are. I think our job is to question and look for the truth and then present the truth, even if it's ugly, even if it's full of thorns, even if it's full of caveats, to present that in as clear a way as we can to the public. And if there's malfeasance, if there's bad faith science, to also talk about that. Something I hear a lot when I write about certain things is, scientists writing and saying, why are you writing about this? You're going to make people mistrust science. Well, I don't think they'll mistrust science. They may mistrust scientists. Regardless, that is part of our job. And I think that part of the job speaks to what the second part of your question, which is how has it been different during COVID? I think, it's always been the journalist's job to ask these questions, but in the past, we've been able to at least sometimes take it on faith that the things we are hearing are true. Especially from agencies like the CDC or the FDA, we've really been able to hear certain things and think that that more or less represents the truth. And that has been not the case during this pandemic. And that's made our job so much more challenging, because now we have to question everyone and everything, including institutions that we really trusted in before.
Thanks. Will or Sarah?
Well, I'll just add that I echo everything just said, and I think I consider myself a translator, maybe a curator of information for the public, and that is how I see the journalist's role. And in radio, we have the luxury of, or maybe the constraints too, of time and the format, which allows us to kind of get away, cancel out a bunch of the noise and try to give people just focus on clarity. And it also is really helpful in leaving people with an impression, a sense of that made sense. I trust that information and not. And in some ways that's a benefit because we can just focus on the big picture. And in other ways, it's a challenge when there's so much conflicting information coming out. And I don't think that our role has fundamentally changed, but I do think, of course, the byproduct of what we do, which is creating a more informed public and transparency to the scientific process, does help protect the integrity of science. But it is not our responsibility is to the listeners and the readers.
Great. And Sarah, you were going to say something.
Yeah, I would just agree with everything Apoorva and Will said about our responsibility being to the readers first and not necessarily to the scientists. We're here to inform readers. I guess to be a little bit introspective for a minute, especially because we're talking about journalism in like a public health emergency, I do sometimes think about the biases that are in journalism. And by bias, I don't mean like left or right or pro or anti-science, but I think there is a bias towards novelty, right, and interesting. And so where you might have, for example, of this is when we started having reports of reinfections with COVID, which are, the evidence suggests are very rare, but they do happen. And so when you have things that are very rare, and when in the context of vaccines, where we'll be giving them to tens of thousands of people, hundreds, millions of people, you might have events that are literally 1 in a million, but that's still going to be a fair number of people who are affected. How do you weight these really rare but maybe serious events? How do you think about the context you give with like in your story, within your your story page, and then how does that get read when it loses the context, when it travels on social media? I think those are also really important judgments that we have to make, especially in the context of vaccines.
Great. Well, we've already started to go in this direction, but what do you all see as the role of journalism, role of media in addressing public concerns about potential COVID vaccine safety issues and mistrust in science around COVID more broadly? Does journalism have a role, or how do you address those issues?
I think, yeah, I mean, I'll definitely journalists have a role in getting the truth out there and in dispelling misinformation. I think, as Sarah said, it's so important to put things into context. I wrote about reinfections a couple of months ago, and one of the things I kept hearing from scientists was, none of this is new. None of this is unexpected. This is exactly what you'd expect to see. This virus is nothing strange. It's behaving like everything else. And so I think it's really important to provide that context. But at the same time, as Sarah said, the numbers are just so big with this pandemic that anything that may be rare and not something that we would normally worry about with a different disease or a different virus is still a huge concern. So walking that line of this is something you should know about, but don't panic is very difficult sometimes. At the Times, we actually have journalists dedicated to looking at what kind of disinformation is out there and very quickly putting that out. We have, Kevin Roos and Davey Albert, two of the reporters that come to mind, who've done a fantastic job. For example, when that plandemic video was going around, or when, myths around vaccines crop up, they've done a really great job of taking those apart. And I think there's absolutely a role for the media in doing that.
Yeah, I think one of also the really important roles of media is setting expectations. As Apoorva is saying, like, scientists will sometimes be like, oh, we already knew this, but like to a reader that may not be true. I think this is also in vaccines has been really important because lots and lots of public health folks I've talked to have talked about how you're supposed to under promise and over deliver. And of course, we're living in a world where our politicians are, very, very much over promising on vaccines right now. So I think, and I think also, it's easy for us journalists to be writing a story and then say like, oh, when we have a vaccine, and this kind of cumulatively all creates an expectation that when we have a vaccine, things will go back to normal. And I think if you talk to people who know anything about vaccines, they'll tell you, of course, it's not going to be a switch that flips. It's not going to be, it might not be that a vaccine is perfectly effective for everyone. So I think one of the roles we should do is not just talking about what is happening, but also what to expect.
Yeah, I think setting expectations is huge, and sometimes I struggle with how to do that. We're all living through this together, and my view with the misinformation is, I never think it's a good idea to try to suppress kind of conversations that are happening because those conversations are going to happen regardless of whether I cover it or not. And so the way I approach those stories, and I think about one of the first moments I dealt with this with the hydroxychloroquine back in the spring, was to say, okay, people are talking about this. There are lots of claims being made. How can I kind of invite people who may have questions or may have kind of believe some of those claims into the conversation? And I tried to do that by actually interviewing some researchers at the University of Washington and elsewhere who were all starting these clinical trials at the time. This feels like a long time ago. And they talked about the scientific process behind that. And instead of just spending 3 or 4 minutes batting down kind of false claims, I tried to pivot a bit more to what the scientists were actually doing. So that was one way I try to kind of approach some of these challenges.
So you all are bringing up the really important issue of misinformation. Maybe we can talk about that a bit more. How do you all identify and report on, you started to talk about this, not only misinformation, but disinformation. We're getting some places which are actively telling non-truths about various matters in COVID science. What's your process for navigating that?
Well, in my case, I just have to pay attention to my Twitter trolls. It's not that difficult because they're in the mentions and in the emails with all of the theories. And often, actually, they give me lots of great story ideas because I see where the chatter is going, and it's easy to sort of pick up on where the confusion is. I think because, conspiracy theories thrive on the lack of information. So when I see conspiracy theories coming up, that tells me that there's a question that hasn't been answered. People are confused about something. People are afraid of something. And that's my cue to go in and ask some questions and get some answers and, get the story around that.
I also think that when I'm writing about disinformation or misinformation, the audience I have in mind is not necessarily the people who are spreading it. I think, I have no illusions that any single article I write is going to change their minds. I think the evidence of actually changing people's minds on vaccines takes kind of a sustained and personal contact. But I think most people come at this not with sort of very set views, but maybe a lot of confusion, maybe a lot of questions. And I think that is the imagined audience I'm writing to when I write about this.
Well,
yeah, I would just add that, and I just had an interesting task of calling about 50 people all over the country who I'd never talked to talk about their impressions of COVID in their community. And I heard many stories that things that I thought were resolved a long time ago, people still think these are really big issues. And I just think the best thing you can do.
What's an example of that?
Hydroxychloroquine, suppress medication. The medication isn't getting out.
Mm-hmm.
A lot of these things about masks. And these are people who responded to a survey. So from Harvard and NPR. So this isn't even. These are people already a bit connected. And I just, my philosophy, and maybe this is partly informed by my work with radio, is that you do your best to have some humanity and humility when people come at you with these maybe totally disputed ideas, and try to find some common ground, or give them do that story, invite them into the story, and have other people talk about it. But I don't think we're necessarily going to change everyone's mind. And I know the listeners may not overlap. Our listeners may not be the people who actually have these views all the time.
Great. And so when you guys are thinking about the time ahead and reporting on the COVID vaccine development process as we get closer and more data, what are you most worried about? What do you think is going to be the hardest thing for you to cover or get to the bottom of?
The fact that there are so many candidates out there, and it's going to be very difficult for people to know which vaccine is good. There's a sort of this sense of competition. What will happen when the first vaccine comes out? What will that do for people's trust in it? And also, how will we get enough transparency around all of those? On a very practical level, I think one of the things has been just keeping up with all of the candidates. And for that, I want to give a shout out to my colleague, Carl Zimmer, and his vaccine tracker. I think it's a pretty fantastic resource to keep up with where all the vaccine candidates are. And it gets a lot of traffic, which tells you that people are extremely interested in knowing where these vaccines are. But I think with the level of public interest and scrutiny and fear around them, it's becoming very difficult, and especially with the political meddling, it's becoming very difficult to figure out where the truth lies from moment to moment. I think everybody has whiplash. So stepping back enough to present a clear picture to readers is going to be a big challenge.
Will or Sarah?
Yeah, I also
what worries you?
I also worry about the politicization. And I think as just like a larger communications challenge, it's one of those issues where even the appearance of it is as bad as it actually happening, because as long as when you create any space for doubt in people, like they will find that doubt. So the fact that everything that's already happened kind of just makes the road ahead even harder.
Will?
Yeah, I think all the back and forth that has been happening will probably continue to happen, does make it hard to make some kind of coherent narrative. And that is something we rely on when doing these stories, is some kind of narrative. I mean, it also requires setting expectations, but that helps people understand what's going on. And I think I'm worried people just tune out because it just seems like everything is all over the place. And I also know, just as a storyteller, it's harder to do stories that are very forward-looking when you don't have, maybe we'll have some examples from the clinical trials, kind of human stories, but it's not as easy to build a narrative around a vaccine that it needs to roll out. And we haven't seen all the positive effects in society yet. And I think that I'm trying to brainstorm how I'm going to be able to tell these stories in a compelling way when there's so much that hasn't happened yet with them.
Yeah. When you guys are calling the science agencies to try and get updates on this or talk about some new development, first of all, do you get a response all the time? Is it easy to communicate with science agencies now? Is it harder than it used to be? And do you feel like you get the full story, or do you feel like there's withholding, or what's the interaction like?
You get very, very little information officially. I don't know about Sarah and Will, but almost, I've written a bunch about now, things happening at the CDC, and my colleagues have written about shenanigans at the FDA, and so much of and even at the White House, and so much of the work is really based on, confidential sources, people being willing to talk at great risk to themselves and to their agencies because they want to speak up. But officially, it's not easy at all, because they've all been told not to speak to the press. I know that at the CDC, for example, scientists have had their studies come out and been told they cannot talk to the press to put their own study into context. So they have to sit back and just watch other people comment on their science, maybe even get it wrong, but they're not allowed to speak.
Yeah, I would say it's very different. I think the CDC, at least in the past, is always like, you talking about their science and communicating about public health as an important part of their mission. And now when you officially get in touch with them, it's either silence or ask the White House.
Yeah, I think that nothing too different here. I mean, my colleagues in DC do a lot of the communication with those agencies, but when I have reached out, it's usually an email response, acknowledgement that you've received it mostly.
So what are you left to do when you want to get, so if you can't get an answer from science agencies when you need it, where do you go?
Well, I get the unofficial version, which is actually much closer to the truth. I have been lucky enough to cultivate some confidential sources, as I think you probably know, and that has been much more helpful than getting the official version. And the official version is often, I don't want to call it a lie, but it's often doctored, shall we say. So it's hard to actually believe it. So I've had to rely a lot more on other sources of information of what's actually going on.
Well, maybe I'll just ask for closing thoughts from you all, just for this audience and for the policymaking community that's interacting with the press around these really critical issues. Do you have any advice or suggestions for people to be useful in interactions with you?
Well, I would just say that I think it's always helpful when people don't just think of scientists or as a kind of capital S, monolithic. I mean, these are real people that we've been hearing working on this, who've invested their lives in these issues. And I find some of my, most compelling kind of stories that come out have some degree of that reflected in them beyond just what's happening, kind of what their motivations are and how they view this moment after having worked on some of these issues for their whole career. So that would be my one thing.
Sarah?
Will, I really like that. I kind of want to echo that because I think we've all been living in a time when our lives have been really upended, and sometimes it can feel like public health people are telling us to do this, but their lives are being affected as well. And I think it's really helpful to know them as humans and how this is changing their lives. For example, I talked to one vaccine researcher who was her home kids were kind of in the background, yelling as we were having our interview, and she was talking about how hard it was that she wasn't able to have her kids in school, and I think that's just like a humanizing aspect of it.
Thanks. Apoorva, last word.
I mean, I think the policymakers that are listening, I would say, you've heard how difficult it is to get the truth from public health agencies for us as journalists. So the more you can step in, if there's the less the CDC and the FDA and the HHS can say, the more we really rely on the national academies or the institute, Johns Hopkins and academic experts to really step up and fill that gap. So we really need you to reach out to journalists, answer our calls, make time for us. And most of you have been, and it's great. And that's really what we hope for, is fill that void, not just for journalists, but also for the public.
Well, thank you all so much for spending time with us and for all the work that you do every day. And we really all are relying on the time ahead. So thank you. And with that, I think that's the end of this panel.